Hello, everyone. Welcome to today's Research America Alliance member web meeting. Thanks to all in the audience for joining us and for your ongoing partnership. We have two great guest speakers today. Dr. Shannon Zenk is the director of the National Institute of Nursing Research at the NIH, and she will speak to us about the vital role nursing research plays, both to improve health and healthcare delivery. Dr. Zenk was previously a professor at the University of Illinois Chicago College of Nursing, and her own research has included a focus on urban food environments, community health solutions, and veterans health. After we hear from Dr. Zenk, we'll be joined by David Goldston, the director of the MIT Washington office. David worked for 20 years on the Hill, including 6 as chief of staff of the House Science Committee. David will discuss the Schumer-Young Endless Frontier Act, parts of which were included in the Biden administration's job plan released yesterday. MIT has been engaged in the bill, I think since its inception at the request of Senator Schumer. And we really encourage you to stay on with us until the end because we will be raffling off a new car. All right, that was my lame attempt at an April Fool's joke. Please type your questions into the Q&A box as we go along, and my colleague Terry Schwartzbeck will pose as many as she can during the Q&A time. So we'll have a Q&A time after Dr. Zenk finishes, and then a Q&A time with Dave. And without further ado, Dr. Zenk, I'm going to turn it over to you.
Great, thank you. Good afternoon, everyone. I want to thank Mary for the invitation to join you today for your Alliance member meeting. I'm honored to have this opportunity to speak with all of you to tell you a bit about myself and my vision for NINR and nursing science. I joined NIH and NINR about 6 months ago, and while this has certainly been a very unique time in our history and in our lives, it's really been special to join an organization working around the clock to help the United States and really the entire world navigate this pandemic. So today I'll first talk a bit about how I got started in research and became interested in community environments as a social determinant of health. And I'm doing that to give you a better sense of what shaped my thinking and vision for the future of NINR supported science. I'll then talk about the health and healthcare landscape, and also about the relevance of social determinants for today's public health crisis, COVID-19, and then conclude with my thoughts on a vision for NINR moving forward and our new strategic plan that's currently in the works. So my initial interest in the role of communities in health came while practicing as a nurse. Like many other nurses, my first nursing job was on a medical surgical unit. After working in the hospital a while, I found I wanted more independence and transitioned to a position as a home healthcare nurse. Spending time in patients' homes and in different communities, I was struck by the tremendous differences in the home and community environments of patients in my caseload, both in terms of privilege as well as poverty. I found it difficult to talk to some patients about healthy eating, for example, when what they needed to restore their health was far more fundamental: decent and stable housing, a safe environment, and access to affordable, healthy foods nearby. These experiences raised questions for me about how resources were distributed across communities and the implications for people's health. So in response, I went back to school and began generating evidence that revealed injustice in the distribution of resources across communities. First in Detroit, later in Chicago, and then nationwide, my colleagues and I found that low-income Black communities have less access to healthy foods and food sources. For example, in the Detroit area, we showed that supermarkets were a mile further from the nearest We're a mile further away from Black high poverty neighborhoods when compared to even white high poverty neighborhoods. This was one of the first studies in the United States on what we commonly refer to now as food deserts. This pioneering research helped spur policy changes such as the Healthy Food Financing Initiative to improve healthy access in underserved communities. We've since generated evidence on how variations in community environments affect individual diet, physical activity, and obesity risk. So, for example, recognizing that existing research is often stymied by local cross-sectional studies with relatively small sample sizes, we developed innovative approaches, including leveraging the potential of electronic health record data to address barriers in research. We launched what at its time of inception was the largest US study of its kind, involving 3.1 million veterans for up to 7 years, integrating electronic health record data with multiple sources of environmental data. We employed in other research a concept from behavioral geography activity space to enrich our characteristic of individuals' environmental exposures. For this line of research, we were early adopters of mobile GPS sensors. We've extended this research to add additional real-time data collection components to better understand for whom the environment matters and under what conditions. And we've expanded this work to evaluate the impact of community investments and policy changes on the environment and health behaviors. So from my prior work, I see 3 key experiences that are already influencing my role as NINR director. Through my many collaborations with scientists across multiple disciplines, I've gained a breadth of experience in and appreciation for different types of scientific approaches. Mentoring future scientists has been a valued part of my career. As was mentioned, before coming to NIH, I was a faculty member for 14 years. And I've learned a lot about promoting scientific excellence through my extensive peer review service and leadership. I immensely enjoyed doing research on issues and populations that I care about and with colleagues from whom I've learned so much. But when I began having conversations about the NINR director position, learning more, and thinking about NINR scientific possibilities and opportunities to make a difference, my excitement grew and I became really interested in contributing to science in a different way. To say the least, it's been a busy first 6 months, and I've had the opportunity, though, to meet with so many amazing people and groups. My first order of business was to meet with everyone at NINR, which was certainly interesting to do virtually, but we certainly made do. We've had a lot of great discussions about the future. We have a fantastic team in place, and I look forward actually to meeting them in person someday. I've been meeting and getting to know my colleagues across NIH who have been so gracious in helping me to learn the ropes and welcoming me to the team. We've also had great discussions about areas where we can collaborate, and I look forward to exploring those opportunities. And I've been meeting with many groups who have an interest in NINR research. And if I haven't had a chance to meet with you yet, I hope to very soon. There's a lot of optimism about the future, and that's really encouraging for all of us at NINR. So turning now to the health and healthcare landscape. As we scan the current health and healthcare landscape, it's clear that there is much work to do. More than ever, we see the need for more knowledge, technology, healthcare, and public health services to improve our nation's health. We face pressing challenges affecting the public's health and persistent health inequities for which we have an incomplete understanding and insufficient solutions. In the current landscape, racial and social injustices have gained broader recognition, including their wide-reaching health effects. Public demand is high for deep and enduring change so that everyone has a chance to live a long and healthy life. Nursing practice and policy solutions in this landscape are urgently needed. For example, although cancer incidence and mortality overall are declining in all population groups in the United States, certain groups continue to be at increased risk of developing or dying for particular cancers, with African Americans having the highest death rates for many types of cancer. So we could look at prostate cancer, breast cancer, and cervical cancer and see troubling disparities. Hypertension-related mortality is another outcome for which persistent inequities are observed. COVID-19 is the latest health condition to appear on the landscape for which large inequities have emerged. I want to recognize and acknowledge that many of you are on the front lines of COVID-19 care. When all is said and done, there will be many unsung heroes from this pandemic, but the clinicians who put themselves at great risk to help others deserve our special recognition and our gratitude. We're all too familiar with the statistics. As of Monday, the CDC reports over 30 million total cases in the United States, with about 546,000 deaths, and that continues to rise every day. We've also seen sobering systematic differences by race and ethnicity and risks of infection, serious illness, and death. Compared to non-Hispanic whites, American Indian or Alaska Native individuals are almost twice as likely to be infected. Latinx individuals are 3.2 times more likely to be hospitalized, and Black individuals are 1.9 times more likely to die. We know that there have been drops in life expectancy. In fact, the drop is the largest seen since World War II. There is already shown a deepening of racial and ethnic disparities in life expectancy. At the same time, I think there's an important role of social determinants in terms of understanding the disparities that have emerged, as well as the likely long-term consequences of COVID-19. For example, washing your hands with soap and water is a critical public health strategy to prevent the spread of the coronavirus. Yet due to water shutoffs or a lack of complete plumbing, an estimated 2 to 15 million Americans have no running water in their home at any given time. And we know the risk is highest in low income and communities of color. Working from home has been a key strategy to reduce community transmission. Yet Black, Latinx, and lower wage workers are more likely to be essential workers and much less likely to be able to work from home. Having services nearby to get what you need facilitates staying close to home and can reduce community spread. Yet tens of millions of Americans live in food deserts. Millions also live in communities without a pharmacy. As illustrated by these maps of Chicago, communities of color are more likely to be food deserts and pharmacy deserts. While making COVID-19 testing and now vaccines available at pharmacies is positive overall, those living in pharmacy deserts are clearly at a disadvantage. Importantly, COVID-19 will likely have long-lasting consequences for the public's health and health inequities, in part because of its powerful effects on social determinants. While it will take a long time to accurately quantify the impact, a large number of businesses have closed, many of them permanently. Latinx and Black-owned businesses have been disproportionately impacted. Millions of jobs have been lost. While employment has returned to pre-pandemic levels in socially advantaged groups, unemployment remains disproportionately high among low-wage workers, those with less education, and persons of color. There are many implications of business closures and unemployment, including lost income and financial strain, housing instability, food insecurity, and the widening of the already extreme racial wealth gap. All of these things affect the public's health. We take our responsibility to the nursing community very seriously at NINR. This past year reminded everyone of the dedication and perseverance of the nursing community. In unprecedented circumstances, nurses have responded heroically to COVID-19 in hospitals, clinics, and health departments, in persons' homes and nursing homes, and in schools, work sites, and criminal justice settings. Nurses have demonstrated ingenuity and changed fundamental aspects of the way they provide care. The nursing community and investigators supported by NINR can play an important role in helping us better respond to current and future crises, while at the same time hoping that the next pandemic is many, many years away. As I said, COVID-19 is just the latest condition to expose ongoing health inequities. So what are the implications for nursing science, and where should nursing research go from here? I think it's important for us to recognize that not all health is created equal, but there are things we can do and things we must do. There are dramatic inequities in the conditions in which people are born, live, work, play, and age, and the opportunities that they have to be healthy. We can see also that it's essential for prevention and treatment strategies that they're understood in and work within the context of people's lives. Unless we respond to the conditions of people's lives and the opportunities that they have to be healthy, COVID-19 will just be the latest health condition of many to appear on the landscape for which disparities emerge, with more inevitably to come. This is where there's a critical need for scientific evidence. And I truly believe that nursing can make a huge difference if we're bold in our thinking and innovative in our approach. And that brings me to what we're doing at NINR to promote science on these topics. I'd like to tell you a little bit about where I see NINR supported science going in the future and how we're planning for that. So when I started thinking about a vision for NINR into the future, some of the questions I considered were, what are NINR and nursing science's biggest contributions to research and health? And what are the areas of expertise that NINR brings to the table? I believe it's nursing's holistic perspective on health that is nursing science's most important contribution to research. So what do I mean by a holistic perspective? Is the recognition that it's important to address health needs at multiple levels, for example, physical, emotional, social, and economic, and create supportive policies, environments, and systems. My vision for NINR is to use nursing's holistic perspective to advance science that improves individual and population health and advances health equity. We can do this by identifying nursing practice and policy solutions across clinical and community settings that are responsive to the realities of people's lives and living conditions, or social determinants of health. Collaboratively taking nursing science to new levels may mean pushing an integrative understanding of and discovered solutions for health determinants at multiple levels, from the molecular to the macro, prioritizing social determinants of health to achieve lasting and upstream change, and identifying effective strategies for integrating nursing practice and policy solutions into clinical and community settings. These approaches are applicable across all areas of nursing science, whether they be in long-standing areas of interest, such as pain, prevention, and end-of-life care, or new areas that we have yet to explore. So I'd like to talk about how we're planning for the future and how you can get involved. But here's a sampling of the questions we're asking ourselves and others as we think about next steps for our research programs. Where can we in nursing science have the biggest impact in solving the most pressing health problems and the most stubborn health disparities? How should we respond to the current health and healthcare landscape? How can we continue to make advances in nursing science and broaden our perspective and our reach? How can we, through our science, have a larger impact on nursing practice and policy? And what kinds of training will help nurse scientists propel transformative science? NINR's current 5-year strategic plan is set to expire at the end of this year. Developing the next strategic plan is our major focus this year. There are several key principles that are guiding our process. Think boldly, think differently, think about the end at the beginning or plan for translation, demonstrate impact, embrace change and opportunity, and mentor the next generation. We're really excited to see where the planning process takes us. And one thing I'm certain of, we'll come out of strategic planning with a bold new agenda for our NINR supported science that will increase our impact. We need an agenda that will break new grounds and open eyes. We can consider that we need to tackle a seemingly intractable problem, challenge, or roadblock, coalesce our efforts around it, and ultimately solve it through our science. We also believe that the entire community needs to have a voice in where we're going. So we encourage all of you who are interested in providing feedback on a bold new agenda for NINR supported science to visit our website and send us an email to the address shown here. So thank you so much for having me, and I'm happy to take your questions.
Thank you, Dr. Zenk. I will use the moderator's prerogative and kick off the first question. What a really terrific, inspiring presentation. NINR is certainly lucky to have you. You talked about the holistic approach that nursing takes, and I think made a very convincing case of really a a unique value that nurses can bring into the research realm. What are some of the barriers now for nurses who would like to add research or move from clinical care to research? And how do we address those? How do we get more nurses involved in nursing research?
Yeah, it's a great question. As you know, we do need more nursing scientists. Nurses play an essential role in health and healthcare, and we know that current nurse scientists are getting closer to retirement. So there's clearly a need. I think there's a need for training opportunities that NINR can support to help prepare nurse scientists at every step of along the way of their education, at graduate school, at the postdoctoral level, and early faculty stage, as well as we're increasingly learning that mid-career is a very vulnerable stage as well. So people are successful, and we're glad of that, in getting their next grant, but then have a trouble continuing the momentum. So this is an issue that we see across NIH, and we see it acutely in nursing science.
Thank you, Dr. Zenk. I believe we have some audience questions, Terry.
Yes, Jenny, we certainly do. And I just would like to remind our audience that you can go ahead and type those questions in the Q&A box. One question that we have, do you have any insights from nursing research that would shed light on vaccine hesitancy among healthcare workers and providers, including nurses?
Yeah, it's a great question, and something that definitely needs to be addressed. I think we know that there are a variety of factors that go into vaccine hesitancy, and we certainly need to do that, addressing distrust and historical issues that particularly have adversely affected underrepresented minorities in the United States. So getting the information out, communicating effectively from trusted leaders is important. We also need to make sure that the vaccine is available to everyone, make sure for not only healthcare providers, but the general public, that vaccines are distributed equitably. And I know and I'm glad to see there's attention to that.
Great. Another question. Has the Institute shifted its focus, as we all have one way or another, as we continue to deal with the COVID-19 pandemic?
Well, I think this last year has been a wake-up call for a lot of reasons, not only COVID-19, but the attention that the longstanding structural racism and injustice in our country. And so I think we do need to respond to the current health and healthcare landscape. And I think nursing is committed to doing that. So I think it's a critical time for us to step back, look at where nursing and nursing science can have the biggest impact in addressing and responding to the current landscape, and ultimately improving the public's health and advancing health equity. So that's what we're doing at NINR as we move forward, is we're looking to see where we can have the biggest impact and what our role is to play.
Terrific.
I was going to say, yep, I got one more. Go ahead, Jenny. I was going to say, medical schools, we may have all heard, have seen a large, if not huge, increase in applications this past fall, which many observers saw as related to the pandemic. Has nursing experienced a similar increase?
That's a good question. Yeah, I would probably want to refer you to the most accurate information from the American Association of Colleges of Nursing. I know my understanding in a recent meeting from them is we haven't seen as much of the surge as perhaps other disciplines. And I think really understanding why that is important. And I think there's important work to do to understand the experiences of nurses and what's happened over the past year.
Dr. Zenk, nurses, as you noted, were on the front lines and still on the front lines of the pandemic and experiencing just extremely stressful conditions. Has nursing research contributed to looking at how to support first responders and the frontline workforce during emergencies such as the pandemic?
Yeah, I think that's such an important issue. And Something that we've been really talking about at NINR over, at least since I've come and probably before my arrival, is just what are the most important questions to understand at this time? What are the most important research questions for the role of nurses in responding to pandemics and other crises such as we're observing now? So I think that those are important areas that we'll be talking about as we're engaged in strategic planning this year.
Well, it sounds like you arrived at just the right time to be able to kick off the strategic planning. Terry, do we have any more audience questions right now?
Yeah, sure. Just one more. Is there anything you can offer on kind of how we as a society shift our perception of nursing from a purely clinical discipline to one that views nurses as both clinicians and scientists?
That's a great question. I mean, we need to spread the word. I think there's unfortunately not enough understanding of the many hats that nurses play as clinicians, not only in clinical settings, but the important roles we play in community settings as well. I mentioned a few: schools, nursing homes, criminal justice settings, work sites. So I think really spreading the word on the many roles that nurses play, including as scientists. We have this unique perspective, a holistic perspective where people are at the center. And I think we are well poised to contribute important science and address important questions that perhaps are not on others' radar, but that nursing, given the amount of time we spend with patients, the trust we've developed with patients and their families, and our work ranging from with individuals to populations, have a really unique role to play.
Great. And then just one other question before I turn it back to Jenny. How can our audience help with your process as you go forward with your strategic plan? Are there opportunities to weigh in, places that people can share input? Anything else you'd like to share about that?
Definitely. You can send us an email right now, anytime, in terms of your thoughts about the future of nursing science. So we welcome you to do that. There'll be multiple opportunities over the next year to see where we're going and provide feedback. And so I welcome everyone to keep in touch with our website, as well as sign up for our listserv to stay up to date on what's going on. So thank you.
Dr. Zenk, thank you so much for joining us today. It's really exciting to have you at the helm of NINR, and we look forward to working with you at Research America, and I know our Alliance members do as well. Thank you so much.
Thank you so much.
For those on, we've posted a number of things in the chat related to Dr. Zenk's presentation. So now we are going to bring David Goldston on. David, I've already given you a fine introduction, and I'm going to turn it over to you so we can hear more about Majority Leader Schumer's plans for reintroduction of the Endless Frontiers Act, and also what pieces were included in President Biden's jobs plan. Over to you,
Great.
David.
Great. Thanks, Jenny. Appreciate it. Thanks for having me. This is a timely moment to discuss this, as activity really seems to be coming close to get underway on the bill. Let me say a word on kind of where it stands in general, and I'll come back with more detail on that toward the end. But since there are so many moving pieces, so as people may know, the Endless Frontier Act was introduced on a bipartisan basis in the House and the Senate around Memorial Day last year. Senators Schumer and Young are working on a bill to be reintroduced, probably right as Congress gets back in session the week of April 12th. Presumably the House version will be reintroduced at that point as well. Senator Schumer has said that his hope is to bring the bill up as part of a whole package of competitiveness measures in late April, to be for the whole Senate in late April or early May. I would say that's an ambitious schedule, but a plausible one. And everybody involved in the bill, I know, particularly Senator Schumer's staff and Senator Young's staff, are working very hard to meet those deadlines. So what is this bill? So the heart of it would create a new technology directorate at the National Science Foundation. And in the bill as introduced last year, authorize it at about $100 billion, at $100 billion, not about, at $100 billion over 5 years. That number could very well decline as part of the reintroduced bill, but it would still be a substantial number, I think at least 50 billion over 5 years. So why do this? And there's some other parts of the bill that I'll also get to, but that's the heart of it. So why do this? So it grows out of the concern about America's competitiveness, especially vis-a-vis China, but these concerns have been around for a long time. And it focuses on one particular piece of what the US may be missing, which is a focused civilian government effort to fund what's called use-inspired basic research. So this is still basic fundamental research. It's not applied research. It's not development. Arguably, it's not even translational research. It's still creating new knowledge, but with a particular goal in mind. So the person, Donald Stokes, who first coined the term decades ago, use-inspired basic research, his example was Louis Pasteur, who was trying to understand fundamental new things about science, but not just for curiosity. He wanted to prevent rabies. He wanted to prevent people dying from drinking milk and so forth. A more recent, but still not of the moment example, though its impacts are, is the development of the semiconductor and of the transistor, both of which happened at Bell Labs in the 40s and 50s. That was basic research. It earned Nobel Prizes, but it wasn't done just out of curiosity. It was done because they wanted to replace vacuum tubes and go from mechanical switching to electronic switching. Some examples of what that might mean today, I'll give two. One of MIT presidents, Raphael Reif's favorites, is one of the concerns in artificial intelligence, an area where we are clearly in a race with China. One of the concerns there is that China has access to more data than the US, both because it has more people and because it has fewer restrictions on the use of data. And data is how you train artificial intelligence systems, machine learning systems with current algorithms. What if the goal of research were explicitly to come up with new algorithms that would enable artificial intelligence to work with less data? That would have many benefits, but one of them would be it would eliminate perceived Chinese advantage in that arena. And one way to do that, to show how broad, cross-disciplinary, and fundamental these questions are, is one area of research that relates to this is actually learning more about how human babies learn and toddlers, because they don't, for example, need 10,000 pictures of a cat to start recognizing something as being a cat. Another area, another example is in advanced, in renewable energy and in semiconductors. Currently, they rely on rare earth minerals to operate. Those minerals are another area where China has a stranglehold among the other problems with depending on them. What if the goal were to design better technologies in those arenas that did not rely on these minerals? So those are the kinds of questions where they're very fundamental, they're broad, but the idea is that they have a particular goal in mind, although the way to get there is still up for scientific and up for grabs from the views of scientists and engineers. So that's the rationale for it and the concern that drives it. So why do it at NSF? So there were, so first, let me say what the reason is not. The bill does not assume, in fact, quite the contrary, that there's anything wrong with what NSF does now. In fact, the bill protects in many ways that we can go into later if people are interested, the current NSF directorates and the current curiosity-driven NSF basic research. This is not an effort to change anything NSF is already doing. It's an effort to build on what NSF is doing. So why build on it at NSF? One, this is designed to fund basic research at universities, and that's what NSF does. It has the relationships, it has the knowledge of the field. It's designed to be broad-based, a kind of focal point for the entire government, even though other agencies may do complementary things. And NSF has that broad purview. Third, NSF is trusted by both the public and the Congress, and so has sort of the operating latitude to figure out how to do this. And right now, also, NSF has a director who's enthusiastic about this new set of responsibilities and who already thinks in terms of how to link different aspects of research together. So the idea is expand NSF's existing mission while continuing NSF's existing mission. The new directorate might has under the bill, at least as proposed before, and I think this will remain, the option of trying out different ways to select projects and distribute money, including adopting or adapting really some of the processes that DARPA uses, but that is totally left up to NSF. It's not mandated. Some of the other aspects of the bill are, it also has a major education component, so would greatly increase the number of undergraduate scholarships, which is actually not something NSF does so much now, except for the Noyce Scholarship Program related to teaching. But anyway, scholarships, fellowships, traineeships, postdoc support in the areas that the new technology directorate would be engaging. It also provides money for universities to think about ways to improve technology transfer, how to make sure that things that are developed in the lab actually make it into the marketplace. There's the possibility of creating test beds as well at the sort of more further along part of the research spectrum. But the heart of it is this university basic research and the education that goes, use-directed basic research and the education component that goes along with that. The bill also creates, has $10 billion to create regional hubs. These would be created by the Department of Commerce, not by NSF, because these are more economic development oriented. And these would be regional hubs. Again, there'd be as with the NSF program, there'd be a competition to select winners, but regional hubs that would try to take the ideas that are coming out for industries and use them to promote economic development, worker development, et cetera, in specific regions of the country. So let me get back to where I started in terms of where things stand on action of the bill. So I already mentioned the Senate plan to reintroduce, hopefully go through normal committee process rapidly, and then bring a package where Endless Frontier would be the heart of it, that would come to the Senate floor later this month or early next. Other parts of that package would deal with things like funding semiconductor programs that were created in last year's Defense Authorization Bill, supply chain issues, some other manufacturing issues, and potentially some other competitiveness issues that relate to technology and China. In the House, as people may know, the House released its version of an Nsf Authorization Bill last Friday. That's likely to be the comparable vehicle in the House, even though there will be a separately introduced version of Endless Frontier. The House bill does include a new directorate at NSF that is very similar to what the Senate is talking about. They call it the Science and Engineering Solutions Directorate instead of the Technology Directorate. They fund it at about $5 billion at the end of 5 years, as opposed to 10 or 20 billion. And there are other distinctions, but I'd say over the last year, the House and the Senate are beginning to converge on an approach. So the hope is that both bodies will move swiftly and then can go to conference. In the meantime, as Jenny referenced in her opening remarks, the administration yesterday in its infrastructure package included $50 billion for a new directorate at NSF in a way that references bipartisan legislation, doesn't say Endless Frontier by name, but there's no mistaking what it's talking about. And so that's a signal that the administration is also supportive of this effort. Although again, the plan right now is to move it in the Endless Frontier package in the Senate and the authorization in the House, not to wait on the infrastructure bill for this aspect of moving the country forward. With that, why don't I stop there? I'm sure there are plenty of questions, and I look forward to them.
Thanks, David. That was a great overview. I think I will kick things off. I know Senator Schumer and Young were very open to receiving feedback on the bill that they introduced last Congress. And that's in part why it hasn't been reintroduced yet. Can you share with us some of the feedback that you've received and some of the changes that you think that the Senate office has received and some of the changes you think may be made in the new Senate bill?
Yeah, so thanks. So that is correct. They have gotten a lot of feedback. And I think it's possible the discussion draft, will be out soon, even before maybe the bill is reintroduced next week. And there'll be further, opportunities, although they'll have to happen quickly for changes as the bill goes through both the House committee. The House bill goes through the House committee and the Senate bill goes through Senate Commerce Committee, and then there'll be conference. But to get to your question specifically, there were concerns from some in the university community about provisions that people worried would undermine NSF as it is, which again is nobody's goal. Certainly not anything MIT would want to see. And so the reintroduced version is likely to remove those provisions that were irritants. Some of those include renaming the agency, creating a board of advisors with congressional appointees, creating a new Senate confirmed deputy director. So those are some of the things that will probably not be in the reintroduced version. And again, that should allay some of the concerns that some of the university community had. I think it will have strengthened provisions on equity issues. And it may also fund a broader array of activities at NSF and potentially eventually at some other agencies, which will help make clear that what the context of this new directorate and its efforts is a very healthy, thriving NSF as a whole.
Thanks, David. Terry, do we have questions from the audience?
Sure. And again, reminder to the audience to go ahead and type those into the Q&A box, and we'll try to get to as many as we can. One question that's come in, some people have argued that funding might be better channeled through agencies that already have a mandate to support specific technology areas like the Department of Energy. Do you have any response or thoughts on that?
Yeah, so that's the gentlest way I've ever heard the question asked. Yes, so this is obviously a key interest, and I think this is something that'll continue to be discussed as the bill moves forward. I mean, first of all, what NSF does should be complementary to what other agencies do in these areas, and energy is obviously one area of interest for use-inspired research. I think, so several things. One is there is an interest in making sure that the national labs can play in and be part of the NSF program. And there's a bunch of different ways people are looking at ensuring that. I don't know which, if any, will actually make it into the reintroduced bill, but that is something that is seriously under consideration. And I know that folks have been talking to the labs about that. Secondly, I think, again, the NSF already does things in conjunction at times with the Department of Energy. And I think that would happen in this case in any place where there's obvious synergies. Third, but as the question presupposes, right, the Department of Energy already has money to do some use-inspired research, especially in things like the EERE program in terms of energy efficiency, and in the fossil fuels program, and in a different way in ARPA-E. Those would all continue. What we lack is a place that has broad responsibility to think across all kinds of technologies, all fields of science and engineering from a civilian point of view, without it being attached to a specific agency mission, to see what the US most needs for overall competitiveness and potentially for other societal needs. And that's the gap that NSF would be filling, that the new technology directorate at NSF would be filling. And then yes, it would have to work with other agencies depending on the specifics. And again, those other agencies may want to make sure that some of their programming fits with that kind of complementary nature. But we didn't feel, I should say that MIT doesn't feel, and the issue has been whether didn't feel that there was a place in the government now that fully filled this role in the way that it needs to be filled to compete across the board against China. And that was the conclusion that Senators Schumer and Young, and in the House, Congressman Khanna and Gallagher, who are the co-sponsors there, that's the view that they came to.
Great, thank you. Another question. Are there any plans for leveraging research in the public sector areas in this package? Research initiatives at the NSF often focus on industrial adoptions, but some areas like infrastructure have very limited capital and conservative regulations they need to meet because public health and safety are at stake.
Yeah, so I think, as I sort of briefly alluded to in the answer to the last question, I mean, this can deal with societal concerns beyond competitiveness. I would say a lot of those concerns overlap, so that our desire to compete, meaning the US desire to compete in areas like renewable energy, obviously that has climate benefits as well as job and competitiveness benefits. But I think this is actually one of the issues that'll be most worked out in conference, is how that list of how that focus area will pick up competitiveness and other interests. I will say that, so the bill, the introduced version of the bill, and I think probably the reintroduced version as well, have initial focus areas. After the initial period, it's totally up to NSF. And I should say those focus areas are broad. They are no more specific than directives Congress has given dozens, if not hundreds of times before. For example, when Congress created the nanotechnology program or the quantum information program or the AI program, it's fully in keeping with that. It's not setting any precedent in terms of congressional direction. But one of those areas does deal with disaster response, for example. So that fits right into the kind of topic that the questioner was wondering about. So the short answer to all that is yes, it will look at more than just areas of industry and competitiveness interests, but exactly how that will all fit together, that's one of the things that has to be hammered out.
David, I have a question. The term use-inspired basic research, is it do you think that it's more applicable to some scientific disciplines than others, or do you think it also requires more multidisciplinary research than perhaps more traditional basic research?
Yeah, so to take the second part first, yes. I mean, the goal, one reason, so there's lots of reasons to put this in a new directorate. One is actually it's a better way to protect what goes on in the existing directorates. Another is the hope is that it will experiment with different ways of doing things, and you need kind of create a new, an additional culture perhaps to do that. But the other is that this is very multidisciplinary, these kinds of problems. And so putting in a place that's their whole approach. It's not that NSF doesn't think about multidisciplinary now, but putting in a place where that's fundamental to the way that it would approach things is important. I think use-inspired research, it may be that it's, one can more quickly come up with examples in some fields than others, but I think it actually ends up drawing on fields across the board. Again, the term dates, back to Donald Stokes' book, which I think was from the 70s. So it's not a new concept. And again, he uses Pasteur as his example, which is certainly not brand new and certainly indicates that health is obviously an area where this applies. But I think, some of the other examples I gave indicate how broadly it may apply. The other thing I will say is while health and biological areas are part of the issues that NSF would look at, and obviously in some of those, they would presumably be working with NIH, which on the human biomedical side is the lead. One of the concerns here is that the physical sciences have lagged behind biomedical sciences in the focus both on in federal research in recent years, where the NIH dwarfs all the other agencies, and also in terms of the problems of getting from idea to focused product. So in the biomedical area, while I know there's a lot of concern about is there enough focus on solving particular diseases and getting to particular pharmaceutical solutions, still generally the line between sort of research and result in the field is shorter and clearer, partly because of the way it's regulated, than it is in the non-biomedical sciences. Similarly, in software, partly because a lot of the expenses to work things out are not as great, and because you can get more quickly from idea to product, in fact, in a period that is acceptable to venture capitalists, we've been okay. But on some of these things that are sometimes called tough tech, where it's physical science-based, non-software ideas, that's some of the places that we've lagged the most. And so that's not the only arena in which the directorate would operate, but some of the impetus for it is looking specifically at that gap.
Great. And actually building on that a little bit, another question just came in. With a budget much larger than that of the entire NSF, it's difficult to imagine how a new technology directorate tail would not wag the NSF dog. With a disparity of scale like that, how will the focus on use-inspired technology development avoid overrunning the stated research mission and culture of NSF?
Yeah, so I guess appropriations has to feed it the right kind of dog food is the metaphorical answer. But the no, so this has been in all seriousness, this has of course been a concern of everybody involved in the bill from the outset. So I think there's a number of things there. First of all, I think when the reintroduced bill comes out, and you can see this in the House bill, although they have a smaller directorate than either the administration or the Senate is likely to propose, that that these segments will start not seeming so disparate in funding. But that aside, there are a number of protections built into the bill to make sure that the tail doesn't wag the dog. And some of these include, again, putting it in a separate directorate, but most importantly, there's a number of things, well, two things that I'd like to point out in particular. One is 15% of the funding going to the new directorate has to be spent in the existing directorates. That includes, and it's written in a way that makes it clear that's including social and behavioral sciences, where you can imagine any number of issues would be relevant to the new directorate. And at the same time, it says NSF cannot transfer any money from the existing directorates to the new directorate. Another provision, very important, says in any year when the existing part of NSF does not get at least as much as the year before plus inflation, the tech directorate can't make any new awards at all. So I think, and then the other protection is just cultural in the sense that no one is doing this because they have a problem with the existing part of NSF, which is different from some other kinds of workarounds in other agencies that have been proposed over the years. Still, all that said, it's something that I think we're all on the lookout for. As I said, I think as the proposals get refined, that will become less and less of an issue. The last thing I'll say is, I won't try to figure out the dog analogy to this, but these two pieces of NSF add to each other, right? So ideas will come out of the curiosity-driven research that will prompt thoughts that can then be taken to the technology directorate. The technology director will be doing projects that will hit roadblocks that will then draw on the curiosity-driven research. It's one reason for the 15%, as well as just making sure that the existing directorates aren't in the wrong part of the dog. And so the sense is that if this works as its sponsors intend, these two parts of NSF will be drawing on each other in a way that there will be a mutual need and mutual support, even as they do different things, and that will be apparent to Congress as well.
Great, thank you for that.
Because it is one thing that it's an important question. It is one thing that people focus on immediately, and rightly so.
Absolutely. Switching gears a little before I turn it back to Jenny, how will the Endless Frontier Act work to boost trainees and support early career scientists, especially after we all know the impacts of COVID-19?
Yeah, so that's a great question. And many of us support other more immediate measures to also take care of the research impact due to COVID-19. So I think in terms of people still in training, as I said, there is a large chunk of money in the bill set aside explicitly for education programs. And again, scholarships, fellowships, traineeships, including there'll be, I think, more language on making sure that takes care of demographic issues in the scientific workforce and postdoc awards. I think in terms of early career people in their first faculty position, I think actually that's something that probably could get some additional attention as the bill moves forward, but simply having this additional funding in a directorate that's looking for new approaches should open up a lot of doors to early career researchers that are not there yet. And actually, maybe that's a good place to just add one thing, as I know we're getting to the end, which is we are talking about, and again, it's an authorization, but people are already trying to think through how the appropriations would work. And NSF has been kind of at a plateau level for a long time, bringing $100 billion more to the agency. And I think that'll actually be $100 billion, not just to the tech directorate in the end, over 5 years, with a signal for why this is central to some of the country's top immediate current problems, will be a big boost to the scientific community and the scientific workforce overall.
Thank you. Thank you, David. I think our time is up. I think this was really instructive and helpful. So thank you. And thank you to Dr. Zenk as well. So just one quick announcement. We hope you can join us for our next Alliance member meeting on Tuesday, April 6th at 2 p.m. And it will be an off-the-record discussion with Alex Keenan, who's the majority staff director of the Senate Labor HHS Appropriations Committee. And I believe there's a link in the chat where you can find the link to register. So we hope to see you then, and we wish you a great rest of the day. Thanks so much.
Thanks.